I'm Steve Baguley and I work for the NWG network. I work across the whole country around exploitation, the transition into adulthood across children and adult partnerships, and I've been involved in the development of transitional safeguarding. Today we're here to talk to Professor Geraldine Brady from Nottingham-Trent University about a piece of research that has been done around CSE and the transition into adulthood that we'd like to share with you today. We'll just start off, Professor Brady, if that's okay. If you can just explain a bit about your background in this field and where you're currently at.
Yep, thanks, Steve. So yeah, I'm Geraldine Brady, Professor of Sociology and Social Work at Nottingham-Trent University, and I'm based in the Department of Social Work, Care and Community. And my background is in sociology and social policy, and I've been engaged in social work related research for about the past 10 years now. So my research interest in child sexual abuse and exploitation really began when I collaborated with colleagues at my previous institution, which was Coventry University. And there I worked with Professor Sarah Brown and Professor Anita Franklin on various research projects relating to CSA and CSE. The first one was looking at really the experiences of social workers around their knowledge and confidence in addressing CSE, and it was quite early days around the concept of exploitation, and that project was funded by the NSPCC. Following that, we went on to undertake research for the Early Intervention Foundation, and in that project we were looking at the indicators around CSE, and we examined 10 different risk assessment tools, which led us to then want to know more about how professionals use those tools. And we were then commissioned by the Centre for Expertise in CSA to look further into it and actually talk to professionals about how they're using risk assessment tools, screening tools, and how comprehensive they are. So they are research projects that were undertaken over the last few years, but in those areas and across those areas, and in talking to people working in practice, the issue of the issue of what happens when children become young adults often came up, and practitioners were rightly very concerned about what happens to the support that young people receive once they actually become a legal adult at the age of 18, or sometimes even before that support starts to be less available to them. So that's my kind of background in the field of CSE research, and that's what brought me to wanting to research further about the ways in which young adults can become just left adrift, really, without support.
Well, thanks, Geraldine. I think that was really helpful, and I'm very aware, obviously, of that great work that you've previously done in this area around risk levels and others, which was, I think, a great benefit. I still think it's an area that we need to do further work on across the country. But if we can talk about some of the work that you've recently done then about this issue that you've identified that practitioners as well as others were concerned around exploitation and abuse and the move from legal childhood into legal adulthood. Can you just tell us a little bit more about the work that you were asked to do, who commissioned it and why? That'd be really helpful.
Yeah, so we responded to a call for proposals. So our team from Nottingham-Trent University and with our colleague Dr. Geraldine Brown from Coventry University, we saw this call for proposals that came out in 2020 from What Works for Children's Social Care, and they were really keen to understand the existing evidence base in children's social care, and they wanted people to propose their own ideas for which areas of children's social care they felt really needed the evidence bringing together and kind of synthesising. And as I say, this was an interest already. So our proposal was that we needed to synthesise the existing research around CSE, transition and safeguarding of young people, but look internationally as well, not just focus on the UK, but to see what's happening internationally. So we proposed that this was a time, you know, the transitional period for young people is a time that really needed further investigation. So our research question actually asked, I'm just going to read it from here, and what does the existing literature say about safeguarding practice for young people aged 16 to 25 who've experienced child sexual exploitation, either before transition or during transition? And also, you know, I've mentioned already about the concerns of practitioners. So people working with young people were rightly concerned about what was happening in this at this period, you know, at this age, with this age range of young people. But alongside that, there have also been quite a number of serious case reviews that have really pointed out that there's a gap in services where young people are not receiving, just left without adequate support often. And certainly if there isn't a planned transition between children's services and adult services, they can be left open to some really quite significant issues. And, you know, CSE, it's still a relatively recent policy concern. Yeah, there isn't lots of there's research around, but there are still lots of areas that need further work and further research, you know, to provide the evidence that's going to support practitioners.
Yeah, and I can completely agree with some of the points you're making. It is very sad, actually, that within child safeguarding practice reviews and safeguarding adult reviews, this issue of the lack of transitional safeguarding and support transition in the adulthood is being raised in a number of those reviews, and is a key driver for why we need to improve the system to stop significant harm and sadly even death happening. So yeah, I'd agree with that. And young people and adults have been telling us for many years that about 18 being a cliff edge. So it's really helpful, the work that you've been looking at. How was this research conducted?
Okay, so our research team, we carried out what's known as the systematic review, and in our case it was a systematic review of the qualitative data, qualitative literature. So we searched the existing literature to see what research had already been carried out into safeguarding young people that had been subjected to sexual exploitation, and we narrowed our focus. So when you do a literature search, you have to kind of, you know, define your terms and use certain terms to find what you're looking for. So we narrowed our focus onto studies that had a focus on young people or young adults, those that focused on CSE, so child sexual exploitation, but also we were looking at before transition, during transition, after transition, and studies that explored safeguarding practice, but only those that used qualitative methods. And also all the studies that we included had to be published after the year 2000 and in English. So the approach that we took, this particular approach to systematic reviewing, was informed by the Joanna Briggs Institute, and our colleague Dr. Alex Toft is trained and has expertise in this methodology, so he really led the way on that side of the review. And what it involves is aggregating and grouping findings so that you come up with what we call synthesized findings, so sort of key areas. So it's a summary, just to kind of say it's a summary of published research, really, but it's really valuable because through aggregating those findings and synthesizing the findings, we're able to pull out and extract the key messages that are across those studies. And also this hadn't been done before either, so it's the first time that this evidence was being drawn together, and we found there was a real lack of qualitative research that met our criteria. We also found that terms for sexual exploitation really varied as well internationally. So it was really kind of important that we were being inclusive to that and not just focused on the UK definition or the England and Wales definition, that we had a definition but expanded from that to the terminology that was being used elsewhere. So in the full review, we go into quite a bit of detail at the outset of the review about the terminology that we're using, and how there's a need to interrogate terminology, particularly in this field of CSE research. There's quite a lot of assumptions made, and sometimes terms used without really thinking about what we're saying and how we're saying it. So you know, you'd expect that from a team led by a sociologist and other sociologists in the team, that language is really crucial, because language influences how we then think about an issue, how we construct it as a social problem, and how we then respond as well, and the kind of interventions that we come up with. So that's something that we thought was really important to talk about at the outset of the review. Yeah, so that's how we went about it.
It sounds like a really detailed piece of research, and interestingly, it's not just got a national part to it. There's an international part as well, which is helpful in terms of identifying the key messages, not just in this country but beyond. We could spend the rest of the day talking about the use of language. Completely agree with you about that use of language and how then it informs our responses. And we have still got some issues around how we're defining some of the commonality, and how we're defining some of the exploitation and abuse that's happening. But I just wanted to move on to ask around, what were some of the key messages and some of the key findings from the research that you conducted?
Mm-hmm. Well, it was, you know, quite an extensive review, and the published review is actually 141 pages long, and it provides comprehensive detail of this methodology, further detail of the methodology, and then we talk about the areas, the areas that guided the research as well. There were some kind of key questions that guided the research, and then the synthesized findings are pulled out, and then we look at the findings and say, okay, so how are those findings meeting these questions that we raised? So all in all, across the data within the published studies, it represents the views of 598 young people. So I think it's important to say that, and 176 professionals as well. So one of the findings, I think probably we haven't got time to go into every single finding and every single kind of outcome, but so I'm just going to kind of give you a few highlights and say, CSE, it's often associated with girls and young women, but it actually in this study could be experienced by any young person. So that led us to point out that we really need to be mindful of not making assumptions about who might be a victim of CSE, or who might be most likely to be targeted, and to really think more widely and not rely on stereotypes, because if we do that, we can overlook the experiences of certain young people that are not necessarily being thought about or on the radar. So that was our first kind of really key finding.
And I think that's really interesting, Geraldine, because what we still see now is there's the move from CSE to wider exploitation, but there's still really a strong gender bias in some of the exploitation, and how it's being recorded, categorised, and so on. It is a slightly improving picture, but it's an area, you're right, we need to look at, and looking at that cross exploitation that's taken part too. So that is really helpful. Thank you.
So boys and young men could sometimes be overlooked, you know, with an assumption that young women would always be the victims, and also young people with disabilities as well. Sometimes, assumed maybe not to be likely to be a victim. We also found that young people's circumstances, so the circumstances in which they lived and were being raised and brought up, relating to their home life, were influential on whether they were left in a kind of a situation that was conducive to exploitation. So if they were living in adverse circumstances, and particularly where relationships were not stable or even abusive, that could leave them vulnerable to being targeted and exploited. So there's certainly a need to think more widely than, you know, in CSE, sometimes in the assessment processes, we're thinking very narrowly about inherent, what risk factors that appear from the way that tools have been constructed to be inherent to young people, when actually there are so many risk factors that are created by people's socioeconomic circumstances and other aspects that intersect with that are much wider than their own behaviour or their own experience. So that's a very important finding, and also related to where environments are very kind of depleted of resources. So when environments are very depleted of resources, then young people haven't got the social capital to tap into. They haven't got social capital to kind of like tap into and access support when the support is so limited. So that's relating to the wider than young people's own experience. And one of the really key things that came out was about the quality of relationships that young people form with professionals and practitioners and those that are have a remit for supporting them. And those relationships really impacted their engagement. So if it's a positive, strong relationship and they felt it was constructive and the professional was almost on their side, or really understood them as a young person, remembered details about them, could remembered the little things, just details about them and their personal life, or had read the notes that may have been on a system before they came to their appointment. Those relationships were conducive to being supportive and helping young people to sort of think through what was happening in their lives. And I think importantly as well, on that note, that the relationships were often with the individual rather than with the service. That came through quite strongly, that yes, they were being supported by various different services or X amount of services, but it was the bond that they developed with the individual that was supporting them, which was the crux of the matter. And they felt really strongly when those bonds were broken. So at the point of transition, if they were then aging out of the service and not being eligible for service because they were no longer a child or seen as a child, and they were expected to move out of service altogether or into services with a remit for supporting adults, they really felt that as a sense of loss. And they said, oh, I'm not allowed to, can't contact my social worker anymore, or I'm not allowed to see them, or they experienced it as, alongside maybe perhaps a number of other losses in their lives as well, or in other similar situations that they'd had to previously deal with. So I think that was, the way that stood out, that it's not just about moving from service to service or making sure that support's in place, but it is about those relationships that have been built. And if young people have already experienced disrupted relationships, it can mirror that when services drop away and they can no longer access them or have support.
Yeah, obviously I've read the full report, and I think to completely agree with you about what research is telling us in this field and others is the importance of that trusted relationship and how we use that trusted relationship with young people and indeed young adults. But I think for me the report what you just highlighted, Geraldine, was an issue that I need to think about more within transitional safeguarding around that how young people viewed the loss of that relationship and aging out the system, and that loss that they felt, which came through in that report. We just need to bear that in mind, don't we, as we look at our service delivery. Is there anything? I know there was a lot of findings in the report, and we could be here for hours talking about them all. Is there anything else you just want to say about some of the key findings?
Well, I just think,
I think they're very helpful.
With age, you know, it was a clear defining factor in determining their eligibility for services and for support. And at the time when they're aging out of services, their risk of exploitation is actually increasing. There's research that shows that age sort of 16, 17 is the time when risk of exploitation is increasing. Yeah, that's another thing to bear in mind, that they're losing those contacts and those support systems at a time when they're becoming vulnerable to that, as well as they move towards more sort of independent living.
It's interesting, you know, I think it's a really valid point, and we see it with post-16 transition too, but the point about aging out the system, about how the risk of exploitation and abuse can, you know, be heightened during that period. I think that's another thing I want to take away from this discussion and others, is to making sure we're including this in our wider narratives around transitional safeguarding.
Yeah, and it certainly is highlighted, I think, in the Bridging the Gap report as well, around transitional safeguarding. I guess another thing to say about the relationships with professionals was that they felt that it was really important that where promises were made or commitments made to follow something up, or to make a difference, or to engage other support services, that those promises were kept, because by not doing that, it could completely destroy trust in the service and in the individual supporting. So there was understanding from the young people that it wasn't always possible to do the things that they would like professionals to do, and that professionals wanted to support them with, or hoped they could support them with. But that came back to making sure that those expectations were managed in that case, so that if something wasn't possible, that it was communicated back to young people. Just simple communication that, you know, it wasn't possible to do that, or there weren't the resources or the funding to do it. But just kind of to manage those expectations, because young people really focused on the qualities and the attributes of the professionals that they worked with, and they wanted them to be reliable, trustworthy, stable, and particularly at that point of transition, so that they felt that they could, you know, felt supported, and that care was shown during that time. And really, care needs to be shown as well. That's another one of our findings, was that care needs to be shown to the professionals and practitioners that are supporting these young people, because they have been through real adversity, extensive trauma, and staff, colleagues, professionals are listening to that trauma and providing support and advocacy through it, so they can be re-traumatized. And in the research that we read, they weren't always getting the supervision and support that's needed when you're doing this really difficult, complex work.
Yeah, I think that's a really valid point, and it came through for me in the report about young people want to be cared for, valued, not judged, and the help with the practical tasks as well, which came out in the report, which was a bit of a surprise in some of the transitional safeguarding, about how that with some of the case studies we developed there, the importance of that in terms of that building that relationship. But I think you've raised a really good point as well, Geraldine, which we cannot forget, that our staff are our best assets, and it's about making sure that we are continually supporting and developing our staff to do what we want them to do. So, you know, avoid any kind of burnout and avoid, you know, the secondary trauma as well. So I think that's a really helpful point to consider around how are we supporting and developing our staff to do what we would like them to do, which we know is going to safeguard and support young people and young adults in this case. But Geraldine, is there anything you want to say about some of the key findings? Personally, I would recommend everyone reading some of the key findings. There's a lot of synergy with the transitional safeguarding briefing, which for me is really helpful. So we're not making any new points. It certainly fits into that, especially the strong message about the importance of that relational practice and others was really, really helpful. But like I said, I would recommend everyone reading, especially the key messages in that report. I thought it was really helpful. If there's nothing else we want to add during this podcast to it, what I want to move on to is some of the work that you've done to disseminate some of these key findings. Is there any planned work further around disseminating this work or developing more? Because I think it's a really important area.
Thank you, Steve. Yeah. I mean, yes, we are disseminating this. So we've last week, 2 weeks ago, we presented a seminar to one of the British Association of Social Work branches, BASWA, Derbyshire and Nottinghamshire, and we were able to, I think we had about 45 minutes, myself and Professor Pam Aldred, to present the findings and, you know, visuals with the PowerPoint and that kind of thing. And there was a really interesting discussion came from that as well for people, and there was a real message of, you know, it's not necessarily anything groundbreaking or well earth-shattering that we've found, or that others aren't doing something similar and finding similar things, like you said about transitional briefing. And it's not rocket science, but it is about the relational and the forming those relationships and making sure that we're not just focusing on risk frameworks and risk assessing, and that we're actually thinking of the strengths of young people, thinking of the strengths of young people and spending time with young people to interact with them at that transitional age. So yes, we presented to BASWA. We're also going to be presenting to another branch of BASWA soon. We did present this research last year at the European Social Work Research Conference as well, and made some links with others from the Innovate project that were presenting there as well. And alongside undertaking this review, we were also carrying out an evaluation of a service that was established in 2012 and established to fill this gap and this kind of address the cliff edge for young women that were reaching the age of 18. So it's a service in Coventry that's delivered by Kairos Women Working Together, and it's called Feeling Safe. And we've evaluated that service over 3 years, but also included the landscape of transition in Coventry at this time as well. So we carried out interviews with stakeholders and partners, the Kairos team, and also centred the voices of young women. And we took those 6 key synthesised findings and we themed workshops from the findings, and we wanted to really kind of explore further whether those findings were, you know, applied to the lives of young women. And we used some very sort of creative and participatory methods, which were probably a bit more fun than the systematic reviewing. I mean, some people love systematic reviewing, but yeah, it's easier to bring those voices to life, you know, from young people themselves when you're working with methods that are more creative. And this is a national lottery funded project. So the two running alongside each other really complemented each other as well. and we've recently launched that report as well. That was just a couple of weeks ago. So that report will also be available to people who have an interest in this area, who watching or listening to the podcast. And what we found there was that the young women really valued the woman-centred approach that Feeling Safe project took. It was holistic, and it was very different to the fragmentation of services that they'd perhaps experienced in the past, because they have to go to one place for housing, one place for mental health, one place for drug and alcohol support, but also some of the difficulties around providing that support are that one service might not want to, or might not feel they're in a position to support somebody until they've addressed another issue. So drug and alcohol service might not support until mental health issue is addressed, and vice versa. But there are such barriers and challenges to accessing all services at the moment, as we know, in these times of austerity and retrenchment of the state. So they really valued that, and they felt really sometimes by other services they'd felt dismissed and not validated, and occasionally re-traumatized by the interactions being so poor and discriminatory, so that they valued the chance to have a service that advocated on their behalf and that signposted them to other services, but worked with them to do that. I mean, one big issue for a lot of the young women in this research was that they find it really difficult to telephone services or to speak to people in what we don't always recognise are our positions of power, because we're gatekeepers to services. So just to work alongside somebody that would support you in making that phone call was really, really important to them. I think the biggest message was it's a service that's not time bound, so it's working with young women from aged 18 to 25, and they can stay in that project for those 7 years if they have, if they still have needs and they need that level of support. They felt safe within the service, and the relationships were caring and gave them hope for what is a long recovery time, really, from trauma and from the experience of either child sexual abuse or sexual exploitation, as well as other issues that are intersecting as well. And it wasn't a time-bound service, when so many services are. And I think even practitioners working within those services recognise that something is not going to be necessarily resolved within 6 weeks or 12 weeks, and there are real constraints in the way that professionals have to work. So this Feeling Safe service it allows the time to work with and alongside young adult women as they transition, and as they as Des Holmes likes to say, transition is certainly not a one-off process, it's a linear process. It takes time. It's a process, rather. It's not something that's going to just happen in a day from 17 and 364 days to age 18. It's a process, and so is it a process in recovering from those experiences as well. So the work in Coventry is ongoing, and we've provided this evidence alongside the systematic review. We also drew heavily on the systematic review in the empirical research that we've done, and there are conversations taking place that weren't taking place perhaps previously, now that we've got research evidence to show what's happening for young people in this age group. Obviously it can be argued that we've known this for a long time, and some local authorities are taking longer than others to get to grips with what needs to happen for young people of this transitional age. But it's good that the conversations are happening. So there's a real will to look towards developing a protocol or a pathway or a strategy around adolescents, young people, safeguarding them as they transition. So yes, it's a kind of watch this space for that one, I think.
Geraldine, you know, I've had the privilege of meeting with you a number of occasions before, but I've still made a lot of notes on what you've been saying today, and I wish we could talk for longer on this. For me, some of the points you just raised there are absolutely vital. One was around quality assurance frameworks, reflecting the trusted relationship in the interventions, not just on the process of assessments and safety plans. So we're making sure that we're supporting our work and recognising what we works within quality assurance frameworks. And I really welcome the point you've made. It's something we're not particularly good at in this country. Sadly, the harm that's caused by abuse and exploitation is quite significant, and we're not always focused on recovery. And I don't just mean recovery from specialist therapists, but all of our roles in supporting that recovery as best we can is not always in the narrative. So and it's really pertinent as well for transitional safeguarding. I just want to say thank you on behalf of the NWG for doing this podcast. I know we will be continuing to work together. I think the work that you've done has been incredibly helpful. There's a lot of synergy with the transitional safeguarding briefing in some of the key messages that we want to take forward on that. And it was some really good points, especially that voice of young people and what they're telling us, which is so vital, but also the voice of professionals. It was really helpful to capture that too. So just in terms of that, I just want to say thank you. And if anyone's got any further questions they'd like to ask Geraldine or myself about this area of work, please get in touch with the NWG and we can link you in with Geraldine as well. But I just want to say thank you for sharing some of the really detailed and thorough work that you've research that you've done into this area. And I would agree more is needed, but some of what has already been found by yourselves, we really need to be taken forward now. And within transitional safeguarding, Geraldine, you're right, areas are at quite different stages in how they're responding to some of this. And we've just got to be sharing the research, the learning, the practice, etc., to help areas to develop a better and informed response. But thank you for today. It's been really, really helpful. I think I'm on 2 sides of notes already, which I need to reread. So thank you.
I'd like to thank you, Steve. Thank you very much for inviting me, for an NWG, to inviting me to talk about the research, because we certainly don't want it to be, you know, sitting on a shelf somewhere. Well, I'll provide links to all the reports and resources as well, and the key project that we've talked about today, the systematic review. The link to that is on the What Works for Children's Social Care website, and I'd like to thank them for funding the research as well, and National Lottery for funding the evaluation of the Feeling Safe service. Thank you for letting me get the messages out to practitioners.
Yeah, and I think the more that we're giving consistent key messages out to areas and practitioners, the safer some of our young people will be, and certainly about how we're supporting them. But thanks, Geraldine.
Okay, thank you, Steve.